Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Sulindac. Its brand name is Clinoril. Now, before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Sulindac is a non-steroidal anti-inflammatory drug, or an NSAID. Its anti-inflammatory activity is due to its sulfide metabolite, which is thought to inhibit prostaglandin synthesis. Aside from its anti-inflammatory properties, this medication also has analgesic or anti-pain and antipyretic or anti-fever properties. In terms of indications for use, Sulindac is indicated to be used in the treatment of rheumatoid as well as osteoarthritis. It can be used to treat gouty arthritis as well as shoulder pain. And it's also indicated to be used in the treatment of ankylosing spondylitis. Now, before somebody was to use Sulindac, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. If somebody has a history of hypersensitivity reactions, such as an asthma reaction or allergic type reaction to other NSAIDs or aspirin in the past, they would not be able to use this medication. They also wouldn't be able to use this medication if they had a hypersensitivity to Sulindac or any other component of the product. And finally, for contraindications, Sulindac cannot be used for post-operative pain following a coronary artery bypass graft surgery, as there's an increased risk of experiencing a myocardial infarction or a heart attack. Now, in terms of precautions, this medication is on the Beers criteria, which is a list of medication that the elderly population should either avoid or use cautiously. We would want to avoid giving this medication to the elderly population unless other pain medications are not effective and they're able to use a gastroprotective agent, such as a proton pump inhibitor that we discussed in other episodes. This is mainly due to the increased risk of gastrointestinal bleeding and peptic ulcer disease. New onset or worsening of fluid retention or edema may occur. Individuals who have heart failure who use this medication may be at an increased risk of experiencing worsening of heart failure as well as edema. New onset or worsening of hypertension or high blood pressure may occur with the use of Sulindac. The use of this medication is not recommended during the late terms of pregnancy. It's also not recommended to be used in advanced renal or kidney disease. Lastly, for precautions, patients should be made aware that some dermatological skin reactions, such as Stevens-Johnson syndrome and toxic epidermal necrolysis, have occurred with the use of this medication. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Sulindac, they can expect to receive their dose orally. If an individual is using this medication to treat shoulder pain, they may try 200 milligrams twice daily for 7 to 14 days. In osteoarthritis, a patient may try 150 milligrams twice daily, and the maximum dose in this setting would be 400 milligrams per day. And the dose in ankylosing spondylitis would be the same, 150 milligrams twice daily with a max dose of 400 milligrams per day. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Sulindac, so I'll go over some of those here now. Up to 3% may experience edema or pruritus, also known as itchiness of the skin. 3 to 9% of patients may experience a rash. Up to 10% may experience abdominal pain, and up to 9% may experience constipation. 3 to 9% may experience diarrhea or indigestion. And some patients may experience nausea, vomiting, or a loss of appetite. Dizziness and headaches may occur with the use of Sulindac. And some patients may experience a feeling of nervousness. Now, some more rare but serious side effects would be a myocardial infarction or heart attack, the dermatological side effects that we mentioned, such as Stevens-Johnson syndrome and toxic epidermal necrolysis, gastrointestinal bleeds or hepatitis, a cerebrovascular accident, or bronchospasm. That's all we're going to talk about today with Sulindac. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.